content and material discussed in these podcasts are for informational purposes only and are not intended to be a substitute for your professional veterinarian's advice, diagnosis, or treatments. Always seek the assistance of your own veterinarian with any questions you may have regarding the medical condition of your pet.
Excuse me, are you in the know? This is a Noman.co production.
Hello, you're listening to Talking Pets Podcast with Dr. Gary Clemens. I'm so glad you can join me for today's topic. Why is my cat eliminating outside the litter box? I can honestly say this is one of the most frustrating situations a cat owner can face. Often cat owners get so upset they start resenting the animals they love, and for some owners, euthanasia feels like the only solution to their problem. Hopefully this podcast will give you a roadmap to help you solve your cat's elimination problem. But before we get started, I wanted to tell you about an interesting phone call I had when I was the host of a weekly 1-hour live call-in radio show called Pet Talk on 55 KRC in Cincinnati, Ohio. I hosted the show for 29 years. Listeners would call in, and I would attempt to answer their pet-related questions. One of my calls was from a gentleman who said his cats were eliminating outside the litter box. So I wanted to get some history, so I said, well, how many cats do you have? And he said 10. I asked him where he kept the litter boxes, and he said in the basement, which can be a problem. I asked him how many litter boxes he had, and he actually said 1. I asked him how often he cleaned the litter box, and he said, believe it or not, at least once a week. So I asked him how many people were in his home, and he said 5. I asked him how many bathrooms he had in the home, and he said 2. Next week, whenever anyone in his home had to relieve themselves, they had to use one of the 2 bathrooms. I asked if they could do this, and he said, sure, that's no problem. Next, I instructed him that no one was allowed to flush the toilets, and he was to call me back next week and tell me how many family members were still using the bathrooms. He finally said, okay, I get the idea. Needless to say, he never called back the following week, but I did tell him some solutions to his problem. Today we're going to be talking about several of the most common reasons cats eliminate outside the litter box, but this discussion will focus primarily on urinary problems and not bowel eliminations. I will be discussing medical reasons, behavioral causes, and owner faults, and then lastly, I will go over possible solutions to these problems. So let's get started. First, we have to establish he isn't trying to get even with you. Fortunately, they do not try to get revenge or to get even. Cats can urinate or have bowel movements outside the litter box, or they can spray urine on vertical surfaces in the home, on furniture, and different places like that. And one word of advice, never punish your cat after the fact. Wendy Christensen, in her book Outwitting Cats, says, your cat doesn't want to urinate on the carpet or defecate in the closet, but sometimes, for some reason, a cat feels he has no choice. Perhaps a rival cat is guarding the only available litter box. Perhaps the box is filthy. Perhaps he's in pain, or perhaps he's ill and can't get to the litter box in time. And it solves his problem, at least temporarily. Your cat may not be any happier with the solution he's found than you are. Cats are clean, fastidious animals. What other animal covers up their own droppings? In the wild, cats take great pains to conceal evidence of their presence and activities. Your cat may be working awfully hard to find spots within your home that are sufficiently private and hidden, and he may be experiencing tremendous frustration and insecurity about his situation. If his problem is caused by illness, he's likely in pain as well. And I say, for all you cat lovers, Wendy Christensen's book, Outwitting Cats, is an excellent book for your library. First, I want to discuss medical causes that can make cats eliminate outside the litter box. For some older cats, arthritis is a common problem, and these cats can have difficulty going up and down stairs. As a result, a litter box in the basement can make it very difficult for them to reach because of their painful joints. Also, if the litter box has very high sides, it may be difficult for an arthritic cat to jump into the box. Cats with diabetes or old-age kidneys drink a lot more water than the average cat, so they will have to go to the litter box more often. If the litter box is in an area that is difficult to reach, they may eliminate somewhere else in the house. Another medical category which can contribute to inappropriate toileting is called feline lower urinary tract disease, which makes up about 5% of the veterinary visits for cats. The signs of this disease would be blood in the urine, straining to urinate, small amounts of urine, smaller than usual urine clumps in the litter box, excessive grooming around the penis or vulva, and aggression, probably due to pain. Some of the more common things that can cause feline lower urinary tract disease are bladder stones, kidney stones, bladder infections, tumors, and a condition called idiopathic cystitis, which we'll talk about later. Now let's talk about each one of these conditions. For many years, whenever a cat was presented for straining or urinating outside the litter box or had blood in the urine, many veterinarians would treat them for a bladder infection. Unfortunately, bladder infections occur very infrequently, except maybe in older female cats. Less than 5% of the cats that have blood in the urine and are straining, especially younger cats, have a bladder infection. As I just mentioned, bladder infections are more common in older female cats. Kidney stones and bladder stones are relatively common in cats. Young cats that develop bladder stones usually have a type of stone called a struvite stone. Middle-aged to older cats that develop kidney stones or bladder stones typically have calcium oxalate stones. When cats have kidney or bladder stones, they frequently have blood in the urine. They can also strain to urinate and pass small amounts of urine. Male cats can develop many small stones, and some of these small stones are like the sand, can pass out of the bladder down the urethra, and along with mucus can form a plug, which can prevent them from passing any urine. If they're not taken to a veterinarian to remove the blockage, these cats will die. Their bladder gets more and more distended, and the poisons that are supposed to be eliminated through the urine build up in the bloodstream, and they will die from uremic poisoning. In extreme cases, their bladder can actually rupture. In the future, I plan to do a podcast on bladder stones in cats. Some cats can have bladder stones and infections, so when bladder stones are removed, it's a good idea to culture the stone and the urine to rule out any possible infection, because if they have an infection, they need to be on antibiotics as well. Some older cats can develop bladder tumors or kidney tumors, but these are really quite rare. One of the most common causes of feline lower urinary tract disease in cats is a condition called idiopathic cystitis. This is fairly common and occurs more often in young to middle-aged cats, male-neutered, overweight cats, and indoor cats that do not get much exercise. It is also more common in multiple cat households and in Persian and Himalayan cats. It is believed the cause of idiopathic cystitis are usually environmental. When cats get idiopathic cystitis, they have extreme pain in their bladder, and some have said it's almost like having a migraine headache of the bladder. So for those of you that get migraines, you know how painful that is. This problem can occur for 3 or 4 days in a row where they strain and often go outside the litter box. When they have to urinate, it comes on so suddenly, oftentimes they don't have time to go to the box, and that's why they'll just pee wherever they are. These cats usually pass very small amounts of urine, and many times this condition can stop abruptly. It may last 2 or 3 days, or it may last a week. When a urinalysis is performed on a cat with idiopathic cystitis, there's usually blood in the urine, but no crystals and no bacteria. Let me stress how important it is to allow your veterinarian to do annual blood tests on your senior cats, usually about 10 years of age. These tests can help diagnose diseases before they cause major problems. So usually as a veterinarian, we perform a CBC, a chemistry screen, a thyroid test called a T4, and a complete urinalysis, which includes a microscopic exam of the urine. Now, let's talk about a big category called behavioral problems. One of the common things that frequently occurs is inter-cat conflict. This can occur when a new cat is brought into the household, or more commonly, in multi-cat households where there are probably too many cats anyway. Occasionally, it can occur where there's just 2 cats in the household. Sometimes cats just don't get along, and some cats tend to be bully cats that seem to enjoy picking fights with the other cats. Often these bully cats will block access to the litter box, so the cat that's being bullied doesn't want to have to go through their territory in order to eliminate and just to avoid any kind of conflict. They will be forced to eliminate behind the couch or somewhere else to avoid a fight. Another thing that can cause behavioral problems are neighborhood cats. Some cats can get really stressed out if they're able to see other cats through their windows. You may never see the other cat, but your cat can. So what does your cat do? He gets really upset, jumps off the couch or windowsill, and sprays urine on the wall right by the window to mark his territory, telling the other cats, "This is my house and you stay away." This is a pretty common cause of spraying in the house. Another thing that can stress out a cat and cause them to eliminate outside the litter box is a new dog in the house. Maybe the dog blocks access to the litter box and the cat has to go past wherever the dog hangs out. And finally, your cat says, "Okay, I'm tired of getting chased by that puppy, so I'm just going to go pee in the closet." The same thing can happen when a new baby is brought into the house, especially if your cat's never been exposed to children. That can create enough stress that it can cause your cat to develop idiopathic cystitis, which I said is mostly stress related. A new husband or a new boyfriend or a roommate can also do it. And if your cat's not used to other people, particularly if your cat's only lived with one person its whole life. A neighbor or friend who owns cats that comes into your house can stress out your cat because he or she can smell cats on their clothing or where they sit on the couch. When they leave, your cat is just as likely to jump up and urinate on the couch saying, "Hey, this is my territory and not the other cat that was here." Your cat can get very upset if she's used to having you home all day and then you take a job and suddenly you're not there anymore. Your cat can get stressed if you go away on vacation and have a house sitter come into your house the cat's not familiar with. Any one of these situations can be the stimulus that causes your cat to start eliminating somewhere in the house or even start spraying urine in the house. When I was a practicing veterinarian, I think the number one reason my clients' cats had elimination problem was that the litter box wasn't cleaned often enough or there were too few litter boxes, especially in multi-cat households. A perfect example is a gentleman that called my radio program with 10 cats and one litter box. You can only imagine what that was like for those poor cats. The first day the litter box was cleaned, probably 2 or 3 cats used it, and then after that they decided they were going to go pee somewhere else. Covered litter boxes can also be a problem, especially in multi-cat households. Cats can be worried they might get ambushed by another cat if they're in a covered litter box because they like to be able to look out and see where the other cats are. Another problem with covered litter boxes is they're out of sight, out of mind. When the box is covered, you're less likely to see if it needs to be cleaned out. With a litter box without a cover, it's much easier to tell when it needs to be cleaned. With a covered litter box, people don't clean them as often and they tend to hold in odors. Another thing is big cats need big litter boxes. So if you have a small size, dishpan size litter box, it's not going to be very good for your big cat. They're probably going to want to go somewhere else in the house. Sometimes that litter box is in an area with too much commotion or it's just too noisy, like a utility room where there's a noisy washer or a dryer. Cats like to have privacy, just like people do. Another problem is some cats don't like the type of litter that people use. Cats like to be able to dig into the litter and to be able to cover it up. Thank you so much for joining me today. So far, we've talked about some of the reasons cats eliminate outside the litter box, such as behavioral problems, medical problems, and owner-caused problems. Now, let's talk about how we diagnose some of these problems, and we'll discuss some of the treatments for them. When a client takes their cat to the veterinarian because it's eliminating outside the box, we as veterinarians have to determine the cause. We know that very few of these cats will have bladder infections, so we have to determine if it's behavioral or owner-caused. In order to come up with a cause, we have to get a complete history from the client. So I would ask how many cats are in the house, what type of litter does the owner use, and where's the litter box located. If it's in a multi-cat household, I would have them draw a map of the house and where the litter boxes are. Does your cat get along with other cats or does it get picked on? What type of litter box do you use and how big is it? How often do you scoop the litter and how often do you change it? How long has a particular cat been having problems, or do you really know which cat is doing it? Have you seen any blood in the urine? If your cat does use the litter box at times, are the clumps of urine large or small? And the reason I ask that, when a cat is voiding normally, they have a pretty decent sized clump of urine with scoopable cat litter, clumping cat litter. When they have medical problems and they go real frequently, they tend to have smaller clumps of urine. So that's why it's always a good idea to realize how big the clumps are. And if you start seeing small clumps, you know that there may be a problem. So after I get the history from the owner, I do a complete physical exam on the cat and feel the bladder so I can collect the urine specimen. I always like to check around the vulva or the area where the penis is for any blood or crystals. The most important thing that we have to do is to attempt to collect a urine specimen. We can collect a voided urine specimen where the cat urinates into a brand new clean litter box without litter, but that's not the best method. The recommended best urine sample is when a veterinarian collects it with a needle and syringe, and this is called a cystocentesis. And most of the time, cats hardly even know we're doing it. One of our veterinary technicians or trained assistants will hold the cat either on its side or on its back for the veterinarian to collect the urine sample. At our practice, we use an ultrasound probe which allowed us to actually see the bladder, and you can actually see the needle going into it. Also, with the ultrasound, you're able to see if there's any bladder stones, or occasionally you can see a bladder tumor, but that's really rare. The reason we take a sample with a needle is because it's a sterile sample, there's no contamination, and if we want to do a culture and sensitivity, we know that there's no contamination on the urine. When a cat urinates, the urine leaves the bladder and the urine passes through the urethra and through the penis or the vulva, and there's a chance for bacteria to be picked up on the way out. When you take it with a needle, it eliminates the bacterial problem. After the sample is collected, one of our technicians centrifuges the urine and examines the sediment under the microscope. And what they're looking for is bacteria, crystals, white blood cells, which can indicate a possible infection. If the only thing they see is blood, then we assume the cat might have idiopathic cystitis or occasionally bladder stones. The gold standard to determine if there is an infection is to send the urine for a urine culture and sensitivity. The lab can tell us whether or not there's any infection, and if there is, they can determine the best antibiotic to use for the problem. If the technician sees a few crystals in the urine, that's sort of a red flag, but it doesn't necessarily mean the cat has bladder stones. Oftentimes, if there's blood and bacteria with white blood cells, veterinarians will often treat with an antibiotic without culturing the urine. It is very important to always do a follow-up urinalysis after the medication is gone to see if there's any sign of infection. If there's still signs of infection, a urine culture should be performed. If on the first visit there is just blood and the second time there is just blood, and you haven't done an x-ray or an ultrasound, then it's a good idea for the veterinarian to do either one of these looking for bladder stones. Diagnostic imaging with x-rays and ultrasound are very valuable tools for veterinarians to evaluate why a cat is having urinary issues. X-rays can be taken of senior cats looking for arthritis of the spine and knees, which can make it difficult to climb stairs and reach the litter box in some homes. If an older cat has arthritis and a urine sample looks normal and he is eliminating outside the litter box, we would recommend a low-sided litter box. You can also take a large storage container, make a hole in the side so the cat can climb in easily. If the home has multiple levels, if possible, it's a good idea to put a litter box on each level, and especially on the level where the cat is eliminating. Let's summarize a little bit. We've done our diagnostics and we found out the cat does have a bladder infection, which again is uncommon in young cats, but it can be fairly common in older female cats. The next step is to dispense an antibiotic. The trouble is sometimes owners can't give oral antibiotics very well. There is an injectable antibiotic that can be given that can last anywhere from 10 to 14 days. As I mentioned before, it's extremely important to check a follow-up urine sample to see if there's any infection after the antibiotic is finished. We will have the owner bring the cat back in 2 weeks and collect another urine specimen to examine or send out for a culture. Now let's discuss idiopathic cystitis. As I mentioned earlier, idiopathic cystitis is more common in neutered, overweight indoor cats that don't exercise and cats in multi-cat households. The causes are environmental factors such as the things I mentioned earlier, like a new baby in the house, too many cats in the house, or one is bullying another cat. Any one of these things can stress out the cat and cause this idiopathic cystitis. As I mentioned previously, when a urinalysis is performed on a cat with idiopathic cystitis, usually the only thing that the technician finds is blood in the urine. Treatment for idiopathic cystitis is to make sure your cat has less stress in its environment. It must be able to get to the litter box without getting ambushed by another cat. Some of these cats have litter preferences, so trying different types of litter is important. Some cats get stressed out by loud noises, so things like screaming children and loud washing machines can cause problems. You want to put the litter box near a safe zone and away from high traffic areas. One of the most important things you can do for your cat is to make sure you have one litter box per cat and then one extra litter box. You need to try to identify the things that stress the cat out and provide safe zones for the cat. You need to encourage your cat to move around more and get more exercise. Do anything you can to enhance the quality of your cat's life. You should have multiple cat perches and cat trees in the house and window perches where the cat can see out. I always recommend putting a bird or squirrel feeder outside the window so the cat can watch squirrels, birds, and chipmunks. You want to make sure that your cats drink a lot of water, which helps the cats that develop bladder stones, and it helps the cats with idiopathic cystitis. Some cats like water fountains. Some cats like to drink out of the water that drips out of a faucet. There are veterinary diets that have ingredients that help reduce a cat's stress. There are also veterinary diets that can dissolve bladder stones. So if your cat has bladder stones and it's a young cat, it's a good possibility that they are struvite stones. And your veterinarian will have different diets you can feed, and then they take follow-up x-rays to see if the stones are dissolved. If they have a bladder infection along with it, they need to be on antibiotics, and it can take up to 8 weeks, but some stones will dissolve in as few as 3 weeks. Oxalate stones, which usually occur in older cats, nothing happens, and those cats usually have to have surgery done. There is a product called Feel-Away, which is almost like a natural pheromone, which helps calm the cat down. They have it in a spray form or where you can plug it into the wall. And your veterinarian can provide oral medication to give to your cat for pain if he has recurring episodes of idiopathic cystitis. And with idiopathic cystitis, when cats have a lot of pain, we would usually dispense buprenorphine or some kind of a medication that the owner could give the cat for those painful episodes, which might only last 1 or 2 days. And I know they're always coming out with newer pain medicines in cats that last longer than 12 hours. So talk to your vet about that. In my own practice, one of the most common reasons I determined that cats were eliminated outside the litter box was that people did not keep the litter box scooped out, or they didn't have enough litter boxes in the house, like the collar. The kindest thing you can do for your cat is to provide 1 litter box per cat plus 1 extra box. Cats also like large litter boxes. My wife Donna and I have 2 cats, Joey and Charlie, and we had 2 large storage containers that we use for litter boxes. I would take the top off the storage container and place it against the wall behind the litter box because one of our cats is pretty tall, and sometimes when he urinated, it went over the edge of the box. The containers we used were probably 8 to 10 inches high on the side, which was nice because it keeps the litter from getting knocked outside the box when they covered up their feces. It's also important to make sure that it's easy for people to scoop the litter and get rid of it. What my wife Donna and I have is a little waste can with a lid on it right next to the litter box. We put a plastic bag from wherever we shop inside the waste can, and twice a day we go down to the basement and scoop the litter, lift up the lid, and put the clumps of urine or feces in the container. And then when the container gets filled up, we just tie the bag up and toss it away. One word of caution: don't put clumping litter down the toilet because it's bentonite clay, it swells up, and you're going to have all kind of blockages in your sewer. When you use clumping litter and scoop it twice a day, the box stays virtually clean all the time. But as I said, don't put it in the toilet. Recently, I went to Lowe's or Home Depot, one of those places, in the section where they sell concrete, and I purchased one of those sturdy plastic containers they use to mix up small batches of concrete to use as a litter box. Our cats love it because it's large and it's easy to get in and out of. The type of litter you use is also very important. Some cats like one type of litter, some cats might like a different type. The type we use is clumping litter, but it's not the real fine sandy material which they can track everywhere. We have a couple of little throw rugs around the outside of the litter box, so when they jump out of the box and use the litter that's on their feet goes on the throw rug, and then each day we shake out the rug over the box to remove the loose cat litter. There are many different types of litter, so if you're not quite sure what type your cat would prefer, you can try several varieties. I always recommend, if you want to switch litter or litter boxes, always keep one box with the old litter and add the new box with new litter, and that way you can see which one your cat prefers and use that in the future. And then once a month you should probably dump out all the litter and wash out the box. If you have a multi-cat household, you want to have litter boxes in different locations, and if possible put them on different levels in the house. And always make sure to put them in areas where one cat doesn't have to cross the territory of another cat, particularly if there's a bully, to use the litter box. Be aware If there are behavioral problems such as too many cats in the household, every time you add another cat to the group, you're going to increase the chances of more types of behavioral problems. These problems can be things such as fighting, chasing each other, spraying urine on the walls, or eliminating outside the litter box. So if you have a multi-cat household, you can expect to have many problems, and you have to work especially hard to try to prevent them. In some situations, it is necessary to give a cat anti-anxiety medication to reduce their stress level, especially if they're spraying urine on walls or furniture. It's also important to use a product that will help get rid of the odors, and we would always use a product called Odor Exit, ODORXIT. This product will get rid of odors that other products won't even touch. They have a nice little pamphlet that goes along with it that tells you how to clean the surface beforehand. And they have a booklet, they have a phone number you can call and get great information on how to get rid of odors, plus other products that they have. I can't stress enough the importance of cat trees around the house. Cats love to be up on high where they can look down on the world, not have to be stressed out by another cat sneaking up on them. So if you have multiple cat trees, it's great for your cats. I've also seen homes where people actually built little walkways on the walls where cats could run around the house. They would have a hole through one wall into another room. That's extravagant, but if you're really a cat lover, you can do that. I mentioned before about covered litter boxes, that people don't clean them often enough. If you're one of those type of people that can't clean the litter box out often enough, you should look into one of the new Litter Robot self-cleaning litter boxes because they clean themselves and you don't have to clean them. So those are always a choice. One other thing, if you have a cat that, say, looks out sliding glass door windows and sees another cat outside, you can buy a frosting from one of the big box stores that you put on the glass. It just peels off, and that keeps the cat from being able to see out and see cats that are outside the house. So that can work very, very well for those type of cats. Thank you for listening to my podcast today. I hope this information I presented can help you solve or prevent problems with your cats so you can rekindle your loving relationship with one of the most amazing animals you could ever own. Please tell your friends to visit my Facebook page, Talking Pets with Dr. Gary Clemens, where they can check out my other podcast and watch for future podcasts. If you have questions about this podcast or recommendations about topics for future podcasts, please post them there. Thank you. So for now, I'm Dr. Gary Clemens. Remember, adopt your pets from rescue groups and animal shelters, spay and neuter your pets, and if God's willing, I'll be back soon with another podcast at Talking Pets with Dr. Gary Clemens. And for now, so long, love on your pets, and have a blessed week.